Most patients with acute myeloid leukemia, we do not know the cause. But for a few patients, we know there are risk factors such as exposure to high levels of benzenes, such in the petroleum industry, or patients exposed to high levels of pesticides used in commercial farming settings, veterans exposed to Agent Orange in Vietnam are at some increased risk. There are also a group of patients that we know are at risk because of their prior therapy for other cancers. Some of the drugs, the so-called alkylator group, or radiation, or a combination of those, do make patients at some increased risk of developing acute leukemia. But for most patients, 98–99% of the time, we do not know what causes their leukemia. It is not an inherited disorder to our knowledge, and so it doesn't appear to run in families, so you don't have to think too much about your children, grandchildren, brothers and sisters, other family members developing acute leukemia. Even though we'll talk a fair amount about genetics in leukemia, these are acquired genetic abnormalities, so they're a result of leukemia or associated with development of leukemia, not something you were born with. So separate that out from your inheritance pattern, the fact that the chromosomes are actively involved in the development and in the prognosis for people with leukemia.